So you just completed having your anterior and or posterior repair or pelvic floor reconstruction. And I'm going to talk to you about your recovery. So in the first 2 weeks, particularly the first 48 to 72 hours, you're going to experience some pain, which we're going to give you a pain medication for. We'll give you a prescription for pain medication so that you can alternate that with an ibuprofen if you can take that. We'll also give you a prescription for something for nausea, because very often you may have or experience nausea after surgery, particularly from the anesthesia. Sometimes you'll get antibiotics at the time of surgery, but sometimes, in some cases, I'll give you antibiotics afterwards. So those prescriptions will go to your pharmacy after the surgery. In the first 48 to 72 hours, you could expect some discomfort, which we would recommend using an ice pack and or some pads with the padsicles that we've talked to you about in your recovery folder that you can prepare for comfort in the perineal area. You may have all the stitches are mostly inside, but you may have some outside and around the perineal area, which is to lift up the perineum from your posterior repair, but those are all dissolvable sutures. But that's when the ice will be really helpful and to help reduce the swelling. We don't want you to have a fever. If you have a fever greater than 101, that's something to prompt you to call the office. You may not be breathing deep enough, and so your air sacs in your lungs may be collapsing. We call that atelectasis, or you may have a urinary tract infection. If you're unable to urinate, we definitely want to hear from you. Voiding is very important. We particularly have you go to the bathroom before you leave the surgical center or the hospital, and we want to make sure you're emptying your bladder completely or at least half. So if you're not emptying your bladder, we definitely want you to call us, because that could be a serious situation. If you have a fever, again, call the office. As far as the first 2 weeks, we don't want you to have any strenuous activity. We want you to lift less than 10 pounds, no cooking, cleaning, housework, lifting, and driving. If you're on a pain medication, we don't want you driving a vehicle. After 2 weeks, you can walk. Certainly during that first 2 weeks, we want you to do leisurely walking. But after 2 weeks, you can go back to your exercise. I wouldn't straddle a horse or ride a bike. That may be uncomfortable, but exercise, Pilates, normal leisure exercise is fine, particularly walking. After your 6-week recovery, you can go back to all normal activity. The other activity we want you to refrain from until we see you for your 6-week post-op or till that time is intercourse. We don't want to insert anything intravaginally until you have complete healing of the vaginal tissues. As far as anything else, if you have any other questions or concerns, or you're having more bleeding than normal, which is common to have a little bit of bleeding, but if you're bleeding more than one pad in an hour, then we want you to call us as well. As far as your recovery, we want you to have a safe and gradual recovery. And if you have any other concerns, you can just give our office a call, 803-457-7000. And we look forward to seeing you at your post-operative visit.